On that morning, he woke up and realized that he could barely hear out of one ear. The frightening part was, he didn't think he was dealing with a problem that needed early evaluation. He thought, maybe my ear is just blocked with earwax. And if it had simply been earwax, it could have been a very easy problem to treat. But this time, there was no impacted earwax at all. The problem was deeper inside the ear. And that is why, when one ear suddenly becomes noticeably harder to hear, you shouldn't immediately assume it's just earwax. He sat in 40s or 50s came to the clinic. He said, "Doctor, I suddenly can barely hear out of this ear." I asked, "Did it happen gradually or suddenly?" He replied, "Almost overnight." That was the first detail that caught my attention, because sudden hearing loss needs to be evaluated carefully. In clinical practice, this is one of the details an ENT doctor should never ignore, especially when there is no obvious cause, such as earwax completely blocking the ear canal. When someone feels that their ear is blocked and their hearing has become worse, one of the first things they often think about is earwax. So I examined the ear canal, but there was no impacted earwax causing the blockage. The ear canal was not completely blocked, and the eardrum could not explain the degree of hearing loss the patient was describing. So if it wasn't earwax, what was really happening? I asked a few more questions. Do you feel pressure or fullness in the ear? Yes. Do you have ringing in the ear? Yes. Any dizziness? No. At this point, I started paying closer attention to the possibility that the problem was not in the ear canal, because ear fullness and tinnitus can occur together with certain inner ear conditions. But based on these symptoms alone, we still couldn't make a diagnosis. We needed a hearing test to find out exactly what was happening. After examining the ear and performing a hearing test, the results showed significant hearing loss in one ear. But more importantly, this was not simply a problem caused by sound being blocked in the ear canal or middle ear. The results suggested a type of sensorineural hearing loss. To understand this, we need to distinguish between two different problems. If sound is blocked or reduced because of problems involving the ear canal, the eardrum, or the middle ear, we call this conductive hearing loss. But if the problem involves the inner ear, the sensory cells responsible for hearing, or the auditory nerve pathways, then it is called sensorineural hearing loss. This is also why simply looking into the ear canal is not always enough to explain sudden hearing loss. And in this case, I began to suspect a condition that we should not ignore: Sudden Sensorineural Hearing Loss, SSNHL, also known as Sudden Sensorineural Hearing Loss. What is happening inside the ear? Imagine that your ear is an incredibly sophisticated sound system. Sound enters the ear canal. It makes the eardrum vibrate. Those vibrations are transmitted through the middle ear. They reach the inner ear. Specialized sensory cells convert those vibrations into neural signals. Those signals travel through the auditory nerve to the brain. Normally, this entire system works almost instantaneously. But in sensorineural hearing loss, the problem is no longer simply that sound is being blocked on the outside. The system responsible for receiving or transmitting sound signals may be affected. And what is important is that the hearing loss can develop very quickly. Sometimes, a person only realizes it after waking up in the morning. This is what I really want you to remember. If you suddenly notice that you can't hear clearly in one ear, don't simply wait several days to see if it goes away on its own. This isn't just my personal advice. Clinical guidelines from the American Academy of Otolaryngology Head and Neck Surgery specifically emphasize the importance of recognizing and evaluating sudden sensorineural hearing loss early. The reason is simple. Many people think it's probably just earwax, or maybe there's water trapped in my ear. Maybe I slept on that ear. I'll wait a few days and see what happens. But if the actual cause is sudden sensorineural hearing loss, delaying medical evaluation may mean losing valuable time to identify the cause and consider appropriate treatment. That is why, in ENT practice, sudden hearing loss should not be taken lightly simply because the patient feels that their ear is blocked. This does not mean that every case of sudden hearing loss is SSNHL. But you cannot know for sure based on how it feels alone. How is it treated? When a doctor suspects sudden sensorineural hearing loss, the first step is to determine the type of hearing loss and evaluate the patient's condition. According to current clinical recommendations, corticosteroids may be considered as an initial treatment option in appropriate patients. Some patients may be treated with systemic corticosteroids. The choice of medication, dosage, route of administration, and timing of treatment should be determined by a doctor based on each individual case. So, do not buy corticosteroids and try to treat yourself without being medically evaluated. The most important goal is to identify the correct cause and not miss the appropriate window for evaluation and treatment. But here is something that many people need to know. Not every case of sudden hearing loss is sudden sensorineural hearing loss. Possible causes include earwax, middle ear infection, eustachian tube dysfunction, problems involving the middle ear, inner ear disorders, or other conditions. So, the important thing is not to diagnose yourself with SSNHL. The important thing is not to ignore a condition that may require early evaluation. You cannot determine the cause simply from the feeling that my ear feels blocked. After appropriate evaluation and treatment, the patient returned for a follow-up hearing test. He sat inside the sound booth, put on his headphones. He sat inside the sound booth, put on his headphones, and waited for each tiny sound. Beep, he pressed the button. Beep, another sound appeared. He pressed the button again. Finally, the test results came out. His hearing had improved. It was a very memorable moment, because before this, he had thought that his ear was simply blocked. Just earwax. And perhaps you needed days. But if he had continued waiting instead of getting evaluated, he might have missed valuable time for assessment and treatment. And this is what I want you to remember. If one morning you wake up and notice that one ear suddenly sounds noticeably worse, don't immediately assume it's just earwax. Don't diagnose yourself. Don't simply wait several days to see if it gets better on its own. Get evaluated to determine the exact cause. Because some cases may simply be earwax or a middle ear problem, but other cases may involve the inner ear, and time can be very important when it comes to evaluation and treatment. You don't need to panic, but don't ignore it. Because sometimes, what seems like nothing more than a blocked ear can actually be a sign that you need to act early. Just remember one thing. If you suddenly develop tinnitus along with hearing loss, even without dizziness, don't wait to see if it gets better on its own. Seek medical evaluation as soon as possible to determine the exact cause. I'm Dr. Tien Tran, and I hope this video has given you useful information to better understand and protect your hearing. See you in the next interesting video.